Hello, my name is Anthony. I'm a BSA1 nursing student, and here's my ID. Okay, do a 360 scan of the room. Okay. And now I'm about to do a 360 scan of the room. Okay. Hello, Justin. My name is Anthony. I'll be your nurse today. I'm here to do a heart and peripheral vascular assessment. Do I have permission to consent for the video?
Yes.
Okay. Can you please tell me your name and date of birth?
Justin Cook, May 20th, 1999.
Okay.
Yeah.
So, in this case, I'll explain to you. So, in this case, I would look at the patient's armband to ensure that his date of birth and his name matches. I'll apply a clean glove, perform hand hygiene, and close curtains to ensure patient privacy. So, what I'm gonna start with now is I get you to lay down. I'm gonna position your head in a 45-degree angle. And what I'll be doing right now is inspecting for your jugular vein for distension. You take your head to the right. Okay, so for what my notice, there's no distension, so that's good. If there was distension, I'll notify the physician. Can you turn the other way from me? Okay, I know that there wasn't any distension from his jugular vein, so right now I'll be palpating his carotid artery, so which is in between the trachea and the sternocleidomastoid. So okay, his pulse is strong. I'll rate this on a +3 scale. It's strong and regular pulse. Now if you touch your head this way, I'll be palpating for the other side. Note that his pulse is strong. I rate this a +3 on scale. Like I said, his pulse is strong. I rate this on a +3 scale. And now I'll be auscultating using the bell of the stethoscope, his carotid artery. Do me a favor, turn and look that way for me. Yeah. Turn and look the other way for me. From my findings, I know that his pulse is regular again, and there were no signs of brewery present. So can you do me a favor and check out your shirt for me, please? You can go ahead and pretty much lay that down for me, please. From my inspection, I noticed that there aren't any lifts coming from his anterior aspect of his sternum. There are no heaves. Which for the heaves, I'll be looking for the PMI, which is a point of maximum impulse. And also there are no pulsations around his heart area, around his intercostal muscles around his heart. In that case, I'll be looking for an enlarged area around the area, which means the overworked heart. So now, what I forgot to mention was for telling the patient to hold his breath while auscultating his carotid artery as well. So now, I'll be auscultating the 5 areas of your heart, which is the aortic, pulmonary, Erb's point, tricuspid, and the mitral area. So let me say, hold your breath. Okay. Right here. Breath again. Okay. Okay. The Erb's point. Okay. Mitral area, which is the apex of the heart. Tricuspid. Okay, good. So basically for my finest, I heard S1 the loudest at the aortic and the pulmonary areas, and I heard murmurs from the Earth's point, and I heard S1 the loudest from the mitral area, which is at the apex of the heart, and the tricuspid area. And now I'll be listening to your heart rhythm. So I'm going to be ascertaining his, from each area that I choose from. I'm going to just choose the aortic area for 30 seconds to listen to his heart rate. And through each point, I'll tell him how his breath. For my findings, his heart rate is a 70, which is a normal heart rate. It's regular. I would say that his heart rate is a +3 because it's regular rhythm, and I can hear it as a regular rhythm. So now, can I get you to sit up for me? You can put your shirt back on and you sit up for me. And now I'll be palpating your leg area around your knee. So basically from my findings with his leg, you can just stick your left leg out for me. From my findings of his leg, I note that the color variations, there aren't any color variations. It's pretty consistent throughout the rest of his body. His condition is it's intact. His hair distribution is evenly distributed throughout the rest of his leg. For his venous pattern is flat. I don't know any abnormal lesions throughout his legs, which is good. If I were to find any abnormal lesions, I would check for the shape, the color, the diameter, and the location of it. For primary, secondary, or vascular lesions, primary lesions are pretty much anything that's from a primary lesions, pretty much anything from freckles. Secondary lesions are pretty much things such as tattoos or scars. And vascular lesions, I'll be looking for ecchymosis, bleeding, the hematoma, things of that nature. So now I'll be palpating your leg for edema. I know that there's no edema present, so that's good. I just need the one leg. So now I'll be listening to his popliteal pulse. So I'll be palpating the back of your leg real quick. Right now, I don't feel a strong pulse right here, so I would have to move distally at that point. But I'll say it's a +1 because I slightly feel it. Now down to his posterior tibial pulse. I note that it is a +3. It is strong and regular. And now for his dorsal pedis pulse, I would say it's a +3, it's regular and it's strong, so that's good. At this point, I would be testing for his pretty much capillary refill, so can you do me a favor and look at the toe for me? around his capillary area. And his capillary refills within 2 seconds, so they are prompt, so that's good. And I'll be checking for any ulcerations. Okay, between the toes. Okay, and I noticed that there are no abnormal findings on his ulcerations, so that's good. Just thinking. And lastly, I'll be checking for his temperature of his leg. Be sure to move down. Can you lift your leg up for me? And note that it's warmer, it's warm and dry, and it gets cooler as I go down throughout the leg. So that pretty much is everything with the heart and peripheral vascular. At this point, we'll be performing Bix, lowering the band to the lowest position, lifting up the side rails, document my findings, and position the patient for comfort, and place the car light within reach.